Kate Martin, 00114935T, Naturopathic Framework, ADVNPNF13. And Naturopathic Framework presentation.
I, Dean Fleming.
I, Aaron Fleming.
On this day,
Monday the 26th of May.
Agree to the inclusion of my contribution in this DVD/video, the nature of which has been explained to me. I understand that my contribution will be viewed by an assessor at the college for the purpose of assessing and marking. I'm over the age of 18 and have agreed to be part of this DVD video assessment on a voluntary basis. I understand that the DVD video assessment, in moderation
for validation processes. I understand and agree that my personal details in this DVD video assessment will be stored and archived in accordance with the college policy and procedure. I have read and understood the college privacy policy and procedure found at
www.think.edu.au/policies and form. My contribution has to be the best of my knowledge, being truthful and honest. I have not deliberately sought to conceal any relevant facts from this maker of this DVD video or assessment for the assessment viewers.
Okay, so here are your fact sheets. So it's basically explaining just a few of what is naturopathy and a few of the principles around that. So there are two central philosophies of naturopathy. These are vitalism and holism. The concept of vitalism is that there is a life force innate in everyone that is believed to have a direct influence on healing and the human energy field. So this energy or force has the ability to elevate a living organism beyond its material properties. Therefore, by increasing vitality, you are strengthening your body's life force or energy, which can be used for healing purposes. Holism is the notion of treating the whole person and not just the physical. This can be related to the concept of mind, body, spirit, and having a balance between these elements. This is recognising that there's a vast array of factors contributing to our health, and the person should be viewed in the context of their whole environment. So how would we apply this to address a specific health issue? So asthma is caused by a spasm and inflammation of the small airways in the lungs. This results in coughing, wheezing, and difficulty breathing. If we are looking at an asthma patient, we should take into consideration not just physical factors, but also the significance of social, environmental, psychological, lifestyle, and dietary factors. This could include encouraging the asthma patient to reduce their allergic exposure, for example, by changing certain lifestyle factors such as quitting smoking. It could also be effective to structure the patient's diet to include more foods that help reduce inflammation, such as omega-3 that can be found in fish flax seeds, or consuming more magnesium to help reduce muscle spasm found in green leafy vegetables, nuts, and seeds. Stress is also a common trigger for asthma, so if it is believed that the patient may be easily stressed or subjected to stressful situation, then treatment should be targeted at reducing stress, such as encouraging exercise, meditation, yoga, or breathing techniques. By increasing vital force, we can strengthen the resistance of the patient. Ways to increase vital force include dietary changes, physical activity, the use of breathing exercises, and the prescription of herbal medicines. Treatments to rebalance the body's energy, such as acupuncture, Reiki, and shiatsu, are also very effective in increasing vital force. While the two central philosophies of naturopathy are vitalism and holism, Western medicine or biomedicine is based on the philosophies of mechanism and reductionism. Mechanism is the idea that we function like machines and that we are made up of separate individual parts. Reductionism is the belief that the matter consists of identical parts and that ultimate priority is given to the ultimate parts. When we relate mechanism and reductionism to medicine, the presence of disease and the restoration of health are dealt with through the examination of the breakdown of parts. Therefore, it's looking at parts in isolation rather than as a whole. This obviously differs to the philosophies of naturopathy, which offers treatment to the body as a whole. Rather than aiming for rapid symptomatic relief, the focus is more upon the ways in which the health of the patients can be directly or indirectly strengthened. This is why there is often conflict between these different philosophies. Although biomedicine is highly effective in understanding the structure and function of organ systems within the body, it often fails to see the bigger picture. That is, recognising all the different factors that contribute to our health and well-being, such as mental, social, environmental, and lifestyle factors. Because these factors are all factors that contribute to the human experience. Biomedicine also often loses sight of the patient as an individual. As a naturopathic practitioner, we are looking at all of the factors contributing to health and providing an individualised treatment plan based on this. How could you apply naturopathic philosophy to your own health practices? There are 6 core principles that should be followed when assessing and treating a client. They aim to treat the patient primarily by stimulating, increasing, and supporting the patient's own healing capacity. The first principle is Vix Medicatrix Naturae, or the healing power of nature. This affirms that the body has the ability to heal and has its own inherent healing process. It is the naturopathic practitioner's role to facilitate this process by removing obstacles to cure and supporting bodily functions. The second principle is Tolle Causam, or the treat the cause. A naturopathic practitioner should focus on treating the underlying cause of an illness or disease and not just suppress the signs and symptoms. For example, taking a sleeping tablet for chronic sleeping problems may alleviate the symptoms, however, does not remove the root cause of the patient's condition. The underlying cause of illness or disease must be identified and the treatment before the patient can make full recovery. The third principle is first, do no harm. Therapeutic actions should be complementary to and synergistic with the healing process. Naturopathic practitioners should utilise treatment methods and substances that apply the least amount of force and that are the least invasive as possible. They should also avoid the suppression of symptoms as this interferes with the healing process. Working with the healing power of nature is also important. If the body's own self-healing process is disregarded, then the patient may be harmed. The fourth principle is doctor as teacher. This principle affirms that the naturopathic practitioner should not only treat the patient, but also educate them and emphasise self-responsibility for their own health. This will empower and motivate patients by having the knowledge and tools to make educated decisions about their health and well-being and be an active part of their own healing process. The fifth principle is to treat the whole person. This means recognising the functioning of the body as a whole and not just the summation of its parts. It also means taking into consideration the vast array of factors that contribute to one's health and not just the presenting signs and symptoms of a condition. The final principle is prevention. The ultimate healthcare goal should be prevention of disease and the attainment of optimal health. By strengthening our vitality and taking a holistic approach to healthcare, we are able to reduce the likelihood of disease and illness. Prevention can be achieved by educating patients about their health and promoting a healthy lifestyle so that they are able to consciously make better health choices and educated decisions. By assessing a patient's current circumstance, interventions may also be applied to protect the patient from further risk or harm. There are several treatment methods commonly used by naturopathic practitioners. Nutrition can be defined as the study of nutrients and the digestion, absorption, and use of these. It requires a deep understanding of micronutrients, macronutrients, plant chemicals, and plant enzymes. Herbal medicine is the use of plants to treat disease or illness and enhance well-being. Herbal medicines have a synergistic effect when complementing plants can create a product of higher therapeutic value, or when a complex mixture is made present within a whole herb product. Homeopathy is based on the theory that like cures like. It suggests that by using small amounts of a substance that causes symptoms of a disease, the body's own defense mechanism will be stimulated to fight off the illness. Massage is the manipulation of soft tissue using a series of non-invasive manual techniques. This can have effect on bodily structures of skin, adipose tissue, muscle, joints, blood, and the lymphatic system. Benefits of massage include increased circulation, reduced muscle tension, stress relief, and stimulation of the lymphatic system. Kinesiology can primarily be defined as the testing and monitoring of muscles, or biofeedback, that is used to identify the imbalances in energy and bodily function. The three main groups of kinesiology are applied, traditional, and specialised. Counselling facilitates the development of an individual's emotional and mental well-being. Counselling provides a safe environment in which clients can express themselves while being assisted in self-growth, creating new perspectives, and setting goals. While naturopathic treatment method offers a holistic approach to healthcare, it is important to consider contraindications to treatments. Contraindication means that treatment or therapy will cause more harm than benefit. Examples of this include performing massage on a client undergoing cancer therapy, giving certain herbal medicines to pregnant or lactating women, or giving supplementation derived from animal products to vegans or vegetarians. Naturopathy can work with conventional medicine to create an integrated approach to healthcare. This means there is uncompromised commitment to the practice of good medicine, whether its origins are conventional or alternative. By using multiple treatments concurrently, clients are provided with a holistic treatment plan using the best of biomedicine and complementary medicine. For example, a client with arthritis may normally be treated with conventional drugs. With the integration of dietary and exercise modifications, nutritional and herbal medicines, the client may improve significantly and more rapidly. Integrative medicine also empowers the patient and enables them to make better health choices. There will be many methods of communication the clients will use to book an appointment. This could include the use of email, text, phone calls, or face-to-face communication. It is important to respond to the client as soon as possible to avoid dissatisfaction of customer service. Once an appointment has been made, it is important to inform the client of a few things regarding their visit. A client should be asked to bring a few things with them to their consultation, including medical reports, x-rays, lab reports, and any current medication they may be taking. Clients should also be informed of the duration of the appointments, cost of the appointment, and health fund rebates that may be applicable. The content of a holistic consultation should inquire into a broad range of factors. These include case history, including general level of vitality in childhood, adolescence, and adulthood, any allergies or intolerances, past major illnesses, immunisations and vaccinations, surgery, disabilities, any past medication, family history, and lifestyle factors such as diet, exercise, and exposure to toxins. There are also several client assessment techniques commonly used within clinical practice. Iridology is the study of health via an examination of the iris of the eye. Each organ, gland, and structure of the body is represented in the irises and in a precise location. The microscopic muscle fibers within the iris duplicate tissue changes as they occur in the body. These duplications are represented in the form of markings, discolorations, and textures. The health of the body can therefore be analysed through studying the iris. Blood typing is another assessment technique used for the purpose of the blood type diet. It is based on the science that your blood type reflects your internal chemistry, which can determine health, disease, longevity, physical vitality, and emotional strength. It also regards certain food intolerances and health conditions that are linked to specific blood types. Hair analysis is used to measure levels and ratios of trace elements and toxic minerals in hair. Analysis can detect whether there is an excess or deficiency of vital nutrient minerals such as calcium, potassium, zinc, and iron. It can also identify overexposure to toxic materials such as aluminium, lead, arsenic, and mercury. Other assessment techniques that may be used include live blood analysis, urine tests, zinc testing, kinesiology, reflexology, and facial or tongue analysis. To provide a professional service, practitioners should keep client records. It is necessary to have these records as they may be used by other practitioners treating the same patient or may be employed for legal or litigation purposes. Client records are also used for practitioners to familiarise themselves with the case on the patient's follow-up visits and to document client progress and recovery. When working as a naturopathic practitioner, there are some clinical, legal, and regulatory guidelines that need to be considered. Holding out is the legal term used for someone who claims to be something they are not. In regards to complementary medicine, this is particularly when a practitioner uses the term doctor or physician or implies they are a medically qualified individual. It is therefore important you do not imply that you diagnose or use terms that may imply you are a medical doctor. It is also not legally acceptable to change a client's prescription or advise them against continuing their medications. If a client wishes for their medication to be changed or stopped, they should be encouraged to consult their practitioner. When treating youth, specific criteria must be understood. A mandatory report must be made to the Department of Community Services if there is any suspicion or concern about the safety, welfare, or well-being of the child or youth. Confidentiality is the ethical principle of holding secret all information relating to clients. The only information allowed to be disclosed is name, telephone number, and contact address for receptionist purposes. This information should remain restricted even if the client passes away or the practitioner-client relationship is terminated. If this is disregarded, the client has legal redress to sue for breach of confidence. The Privacy Act has been developed to protect personal information, which includes the collection, use, and storage and disclosure of this information. The Privacy Act also states that a client may request their personal records at any time. Records should therefore be accurate and free of any judgmental or embarrassing comments. Practitioners should be aware of ethical considerations. This includes being aware of cultural and religious values and treating clients accordingly. Practitioners should respect all clients and not engage in any form of discrimination due to their sexual, physical, emotional, or financial circumstances. Clients should be encouraged to make their own informed health choices. Practitioners should also be aware of their own limitations and use referrals and other healthcare professionals when needed. Any questions?
No, but I have a statement. You know the kinesiology thing? You know we were doing that on our horses.
Really?
Yeah. It's unreal. You should have seen that stuff. What they did up there was incredible. We actually employed a guy that specifically came out and did that.
Any other questions?
No, I thought it was a very good presentation. No.
Thank you.